Hi, I'm Sister Louise Nix and I'm Head of Care at CPOA. Each year we usually have an Alzheimer's webinar or seminar, but this year we're doing something just a little bit different for Alzheimer's Month. Alzheimer's is a progressive disease that affects the memory as well as other important mental functioning, and this can have a huge impact on loved ones as well as the person suffering from dementia. There are certain factors to consider and look out for as the disease progresses. This video will give you insight on what to look out for before and during this challenging time. I'd now like to introduce Sister Ansabel Kirsten, who is the Care Operations Manager at CPOA. She will be talking about red flags and what to look out for.
Sometimes sudden onset of a different behavior pattern can maybe let them think that this person is suffering from Alzheimer's disease. We need to determine whether it is actual Alzheimer's disease or is it most possibly confusion. Confusion is a terrible condition. It often presents itself in older people. People get confused for many different reasons, like they have no reason to wake up in the morning. Dehydration, because it's just too much of a hassle to go to the bathroom often, so they stop drinking. Or they don't want someone to help them, to take them to the bathroom, or to change a nappy. So this often leads to urinary tract infections, which can cause more serious problems. And then also polypharmacy. This is what happens when they take their medication wrongly. Impaired homeostasis. This is what happens to the performance of the cells. They deteriorate and they can no longer send proper signals out, and that causes confusion. So if confusion is not signs of Alzheimer's disease, then what is the warning signs that we need to look out for? The red flags identifying Alzheimer's disease is the inability to cope with their daily activities. Things that were never a challenge becomes a huge challenge for them. Their family and friends distance from them, or they withdraw from them. Changes in their personality, mood swings, impaired reasoning or judgment. They lose their lust for life. So the most important thing for us is never to make a diagnosis for our loved ones until it's been professionally diagnosed. We need to find help if we're uncertain. The World Health Organization predicted that in 2050, 80% of people living in long-term residential care facilities will suffer from some form of dementia. CPOA can offer guidance and support to families.
I'd like to now introduce Sister Nikki Hanekom, who is the Care Manager at Anchusa Care Centre. She will be discussing transitioning into memory care.
Transitioning into memory care is a big event in someone's life. It can cause tremendous anxiety. I often have contact with my applicants or potential residents and families for a couple of months prior to admission. Their first visit, they normally come and view the facility, and quite a number of visits can follow from there on before the resident is actually admitted. In those visits, we try and also make contact with the resident so we can introduce ourselves and start developing a relationship with that person. During the visits with all the families, we discuss the expectations that the families have for their relative and from our care centre, and we encourage them to get the room and the environment ready for their loved ones prior to the move, so that the resident can feel comfortable and have familiar things around them that come from their home, favorite blankets, little pieces of furniture that make them feel at home and comfortable. The residents and the family have a lot of fears around institutionalization, and we ensure at all times that there's open communication. We have different ways of communicating by email or by WhatsApp, just to give an update on the loved one's condition, or how their afternoon's been, or how their morning's been. And they're also welcome to come into the office and discuss anything with me. All the care centres are quite different, and we encourage you to spend time to go and visit the care centres and see what their feel is and how it would suit your loved one. In our care centre, we individualise all care that's for each resident. On admission, I assess the care needs of each resident, and we draw up a care plan that is specific to each resident. Prior to admission, all the staff are briefed on the resident and briefed on the care that we need to provide to that person, because the staff would then be familiar with the resident. And often the potential residents come to see us prior to moving in, so there is a relationship that develops between the staff and the residents and families. Our residents come in at different stages in their dementia or Alzheimer's. From mild to severe. We often rely on family members to give collateral information, so that we are able to look at the total whole of the person and not just the memory of the person.
I'd like to now introduce Sister Linda Glynn, who is the care manager at Avondrus Memory Care Centre. She will be discussing communication of engagement with your loved one.
Communication is really important, but it's also really difficult for the families, because the person obviously with dementia doesn't follow like the conversation we're having now. So they hop and skip and jump around a bit, and when you try and bring them back to what you're talking about, then they don't really understand what you're saying. So you need to be where they are. So you need to understand and work with what they are saying, not what you want to say, but what they are saying. So, if they talk about the weather or the chair or whatever, that's where your conversation goes. And when you answer them, you need to speak clearly, slowly, softly, and don't keep trying to bring them back to what you want to talk about. Just let them talk, listen, nod, say, sure, that sounds interesting. Ask a few questions. So if they're talking about family, for instance, then you can ask a few questions, but let them have the conversation. It's a lot easier that way. So it can be difficult for families to understand that, because they want their relative to speak like they used to. But actually, if you just allow the resident to talk and speak and say what it is that they need to say, then there's no confusion or irritation on anybody's part. So it works better that way. It's very daunting for families to bring relatives into a dementia wing particularly. Often it is very difficult. They've had to go through the whole process of putting someone into a home, into a facility. That brings about a lot of emotions. The carers that look after the residents predominantly are usually very patient.
I'd like to now introduce Sister Yvette Kruger, who is the care manager at Sea Point Place Memory Care Centre, and she will be discussing a day in the life of your loved one.
The day in the life of an Alzheimer's resident isn't very typical, because it changes every day. And trying to understand Alzheimer's, you have to understand the stages that you get. There are 3 stages. Early onset is when you can still function on your own. You can live in a flat, you can go out, drive your car, do groceries. But small things will happen, like you'll forget where you put your car keys, or you'll go into a room and forget what you wanted to look for, or you'll actually go to the shop and not know what you wanted to buy. So it's very frustrating for an individual, and sometimes it is not noticed because they think it's just forgetfulness due to age. Then the middle stage is the most difficult stage for the person himself and for the people looking after that person, because they're not as far gone to be totally demented, and they're also not able to live by themselves anymore. So it's a frustration. Each one experiences dementia differently to another person. So each one are treated individually, and you do certain activities with certain people. That is the middle stage, and it's a long stage before they finally go into the final stage where they are totally up with the fairies. They are happy, they are content, they sleep most of the time. They do not make sentences, they would rather just make sounds. No activity is stimulating enough to keep them awake, so that's why they sleep enough. But it's a good stage for them because they are at peace and they are pain-free and they are content.
Let us at CPOA help you and your loved ones during this challenging time. Please make contact with us on 021 686 7830, or please visit our website www.cpoa.co.za.